What are the basic measures you should take when your kid has a runny nose and fever? The probable diagnosis in this scenario is going to be a cold, a viral infection. When I say viral, I'm making a difference between bacterial infection, such as ear infections, some pharyngitis, and pneumonias, skin infections, and things like that. Viruses are completely different. The main difference is that viruses do not respond to antibiotics. No matter how many antibiotics you give, what type or what form, whether oral or injectable, they will get better on their own. It's not because of the antibiotics. So that's the number one thing. When you have a cold, do not give antibiotics, even if you have them available or somebody can get them for you. Now, the basic principle, and of course this is mainly applied to kids 3 months and older, is that if the fever is low grade, say 100.5, leave it alone. Just see how high it gets, because if it gets into the 102.2 or above, then that becomes a more significant fever that you probably have to get checked out by your doctor. Now, if the child has a 101 fever and they are uncomfortable, sure, go ahead and treat it. There's no problem with that. But remember, fever is not the problem. The problem might be whatever is causing the fever. So don't be fever adverse or fearful of the fever itself. Fevers will not cause anything. The cause of the fever is what matters. Remember that. Now, for nasal congestion, there's nothing better than nasal saline, either drops, sprays, or even sinus rinses. That is the most effective way to get your kid to feel better. Now you might think, well, my kid's nose is already runny, why am I going to flush with saline? Well, the reason is that the runny nose that they're having is not necessarily liquidy. It might seem liquid, but it's mucousy, and it's going to get stuck in the sinuses and other parts of their nose, and it's going to drip into the back of their throat, and the typical symptom of that is that they're going to start coughing whenever they lay down. So flushing it with saline is the most important thing. Medications, they have never been proven to help, especially in the young children, less than 4 years of age. You don't want to do any cold medications. But, you know, if push comes to shove, and you do want to try something, I would do a low dose of Benadryl, maybe some Mucinex by itself, nothing that's combined. And just give your child some symptom relief by propping them up on a pillow so that the angle itself helps them not be dripping into the back of the throat. And those are the basic things. Now, what do you look for? What are the warning signs? Well, worsening in any respect. What I mean by that is if your child is sick and today they're sick and they have a 101 fever and they're coughing but they're active, and tomorrow they're exactly the same as they were the day before, that in a certain way it's good because they're not getting worse. Now, if they start with progressively worsening fevers, progressively diminishing appetite, they might start breathing heavier, they might start losing their activity. Those are all reasons to go to your doctor and get it checked out. As far as the dose for Tylenol and Motrin, check with your doctor. You want to always make sure that the dose is appropriate. But in general terms, either one can be dosed at 10 milligrams per kilogram as a maximum dose. Tylenol you can go a little bit over, but I would say you don't unless your doctor tells you to. So like always, if you have any questions, by all means, please give me your feedback in the comment section. I'll try to answer them either there or in a later video. I hope this helps you get some basic information, and I hope to hear from you soon. Take care.